Hi, this is Dr. Weafi, and in this session, we look at the public health system in the US. This presentation was initially prepared by the Centers for Disease Control and Prevention, CDC, in 2013 as a stakeholder training resource. I've modified it for the presentation today. This public health in America statement was developed in 1994 by the Public Health Steering Committee. It provides a vision and mission for public health as well as the context for which public health should be prepared to do and how public health services are delivered. The vision for public health is broad: healthy people in healthy communities. The mission is to promote physical, mental, and I should add, spiritual health and prevent diseases, injury, and disability. These are lofty goals for the citizens and residents of our country. Let's look at how these goals can be implemented. From the previous century, the average life expectancy in the US increased by more than 30 years, and public health improvements are credited for 25 of those years. Some of these public health achievements include making workplaces safer, improving food and drinking water hygiene, and implementing vaccinations which controlled many infectious diseases. The foundation for public health lies within the three core functions, namely assessment, policy development, and assurance, which are further developed into the 10 essential public health services in 1994. These were applied to and implemented at the various levels of the US government. In order to promote the performance of public health and the corresponding outcomes, several key components need to be implemented. Investments in the health department and public health system, including developing the workforce, builds operational capacity and infrastructure. This infrastructure impacts all community programs and public health activities and leads to better health outcomes, reduced disparities, and enhanced preparedness to meet public health goals. Investments in the three core functions of public health lead to big dividends in the form of improved public health outcomes. Which of these goals in place? With these goals in place, let's now look at how public health services are organized in the US. There are various levels of government agencies that implement public health services, including state health departments, tribal health departments for Native Americans, local health departments, which are typically at the county and even city levels, and and territorial health departments for the U.S. territories, including Puerto Rico, Guam, and other islands. These governmental departments were given the primary responsibility for public health from the U.S. Constitution, the policy document which founded this country. You can see from the numbers that the vast majority of public health agencies are found at the local level, with the states taking more of an oversight and reporting roles. The divisions which we just saw report up through the states to federal public health agencies, like the Centers for Disease Control and Prevention. These national agencies have large overarching responsibilities, which you can see listed here. I'll highlight two of them. The second bullet is act, when health threats may span more than one state, a region, or the entire nation. A good example would be an event which impacts more than one state, like a hurricane. The fourth bullet is act to assist states when they lack the expertise or resources to effectively respond in a public health emergency. An example of this will be an emerging infectious disease where little is known about the cause or response of the infectious agents. A recent example was the outbreak of Zika. Although this occurred outside of the US, the CDC was not only monitoring, but also assisting these countries in the identification of the virus, how it spread, and the morbidity and mortality rates. Other public health responsibilities of the federal government include providing leadership in setting the public health agenda, giving resources, both financial and operational, and supporting the development of technology to improve public health at all levels. State health departments have very different roles from the federal government. These responsibilities include screening, such as newborn screening, HIV/AIDS, TB, and diabetes. Treatment, such as TB, STDs, and HIV/AIDS. Technical assistance and training for emergency responders, hospital, data management, and policy development. State lab services for testing of bioterrorism agents, foodborne illnesses, influenza typing, environmental toxins, newborn screening, epidemiology and surveillance, such as data collection and epidemiology of communicable infectious diseases, vital statistics, chronic diseases. This chart displays the various sources of funding to state healthcare agencies across the US. In 2011, the largest source of state funding of public health revenue was federal funds, followed by state general funds or tax dollars. Now let's look at how local public health agencies are organized across the US. Each local health department is organized as one of these system models. The local health department that is led by its local government is referred to as a decentralized model. Mixed means that there are different models within the same state, Some local departments are led by the state and others are led by the local government. Sometimes this occurs when a smaller county lacks resources and contracts with the state to provide these services. If a local health department is a unit of the state government, this is a centralized model. The local health departments that are governed by both the local and the state authorities are called a shared system. This map indicates which states organize and govern local health departments. Green states are local or decentralized. Gray states are mixed. Yellow states are centralized. And only 3 states are red states, which are shared governments. Based on this map, the majority of states are organized which way? Can you think of a problem that might occur which states governed differently for public health services? Would the yellow states be better organized and more efficient than the red states? The top 10 most frequent services provided by local health departments are listed here on this slide. These activities center around preventing infectious disease outbreaks and surveillance of environmental hazards. However, even with the food safety program, which permits and inspect eating establishments and train food handlers, there are still an estimated 48 million cases of foodborne illnesses each year in the US. Does this mean that the program isn't working effectively? What if the food safety program didn't exist? Do you think the number of foodborne illness cases would increase or decrease? This graphic shows the sources of funding for local health departments compared to the state funding sources. Counties obtain most of their funding through local fees and taxes, followed by state and federal dollars. Now, let's look at how public health is organized for Native Americans. A number of organizations work together to deliver health services to these indigenous groups. The Tribal Health Department is a health department, corporation, or organization operated under the jurisdiction of a federally recognized tribe or association of federally recognized tribes and funded by the tribes and or contracts services from the Federal Indian Health Service. A tribal health organization includes tribal health departments, Indian Health Service units, area Indian health boards, and urban Indian health centers. Government is not alone in developing, designing, or delivering public health. It takes a village. Many different types of organizations participate to improve health within the communities. The goal is a system of partnerships that interact collaboratively and effectively with all levels of governmental, public health, and each other. This graphic on the slide depicts how non-governmental organizations collaborate with the Public Health Agency to ensure health for all. Each of these organizations plays a role in improving the public's health. Collaboration happens at all levels to deliver and ensure health. This includes partnerships, effective communication, overarching health objectives, sharing resources rather than competing for them, leadership provided by the government agency, and feedback from all partners. I hope with this brief presentation, you can see how public health is a very diverse, interconnected network of partnerships that work together to ensure health for everyone. I am Dr. Wiafe, and thanks for watching.